I had my gastric bypass in May of 2011, and after 2 years, I lost 100 pounds. After losing 100 pounds, I had a lot of excess skin on my belly. I've always been big around my belly area, so that's where I carried all my weight. I felt very unhealthy with it and wanted it removed.
The problem is when you lose that much weight, your body and your skin cannot go back to where you would like it to go back without help. And there's no way with exercise that you can get rid of the extra skin that's hanging, that has been stretched out, often has a lot of stretch marks. And in some patients, you do need to do a brachioplasty or remove skin from the arms. In some also you need to do a breast lift. In some you have to do a facelift to correct the extra skin around the face. So everyone's a little bit different. In Karen's case, her major problem was her abdomen, where she had all this extra skin and this pannus that she wanted removed, that she could not get rid of, despite the fact that she ate well and despite the fact that she was working out regularly.
When I came to see Dr. Azouz, I weighed 151, and that was because I was still carrying all the fat that was around my belly. He had explained to me the different procedures that he has. He explained to me the tummy tuck in particular. It was what I was interested in. When he examined me, he found a hernia, which he repaired while he did my tummy tuck. Dr. Azouz cut off 8 pounds of fat from my belly.
And of course, her skin was very poor quality. It was all had been stretched out from when she was a size 24 or 26.
Once I had my tummy tuck done, I dropped like 4 sizes right away. Dr. Azouz told me when I had the tummy tuck, I would lose another 20 pounds plus what he cut off, and I did. I started at 248 before my weight loss, and after my tummy tuck, I'm now at 124, size 0.